everybody, welcome back to Perinatal Bloom, or welcome if you're here for the first time. We're very happy to have you. Here on this channel, we unpack all things birth and beyond. And so this may be looking at deep dives into pregnancy, birth, postpartum, or postnatal care, as it's called in the UK. This may be looking at differences between birthing options in the UK versus the USA, care options, what some of that support may look like, and all things to do with our birthing and parenthood journey. Whether you're just preparing, if you're just looking around and you're curious, or you're already in the thick of it, or you've recently welcomed a baby, hopefully you will find some really great education and a source of community and support here. So welcome, listen, learn, subscribe, share, and I'm very, very happy to have you here. So, whether you're moving over to England or the UK, so Scotland, Wales, Northern Ireland, or maybe you're already here and you're preparing to welcome your first baby, or maybe you're just curious about what pregnancy, birth, and postnatal or postpartum may look like in other parts of the world, the thing that we're going to talk about today is what you can expect from the various providers in the NHS throughout your pregnancy journey. So sort of from the moment that you become pregnant and all the way through those early postpartum days at home. So we're going to look at people like MSWs or MCAs. We're going to take a look at RMs or registered midwives, consultants, and then also specialty midwives as well as nurses. One of the big misconceptions is that nurses are have the same function in maternity care in the UK as they do in the USA. So in the US, if you go into a hospital birthing center, you will probably have a labor and delivery nurse, and they will also have postpartum nurses. In the UK, it does differ a little bit. It can vary from trust to trust. There can be some differences because of sort of staffing needs, but for the most part, nurses are actually not providing maternity care, and all of that is provided by registered midwives. So we'll take a deeper look at what registered midwives do. You can also have some overseeing obstetrician consultants. So in cases where birth becomes a little bit more complicated, or you have some maybe unexpected challenges with your birth or other health complexities or comorbidities, at that point an obstetrician may be overlooking your care and working in collaboration with that midwife. But for most typical low-risk, normal kind of pregnancies or run-of-the-mill pregnancies, it will be midwifery care rather than nursing. Once you find out that you're pregnant, congratulations. One of the first things that you will do is you will either self-refer to a midwifery service, or you may need to go to your GP or general practitioner and they will put in that referral for you. This will vary from trust to trust or area to area, or even sometimes clinic to clinic, so it will depend on your clinic's practices. But in most cases, you're going to be referred to the midwifery service, so you're going to be put on their radar. At that point, they will schedule what is called a booking appointment, and this is kind of where you become part of that midwifery care. And they will go over your medical history, they will go over kind of that early pregnancy, confirm your pregnancy, sort of establish the timeline of where we think you are in the pregnancy, estimated due dates, all that kind of stuff. And typically from this point on, anything to do with your pregnancy, the midwife is going to be your first point of care rather than your GP. One of the things that catches people off guard is the fact that there's a lot less visits to a medical professional in pregnancy in the UK versus what we're used to in the US. Again, in the US, this may vary from doctor to doctor, clinic to clinic, but in most cases, what we find is that we are attending appointments about every 4 weeks in earlier parts of pregnancy. And then as we get closer to our due date, it become a little bit more frequent, like every 2 weeks. And usually in the last couple of months or in the last month or so, we're going to have weekly prenatal appointments. In the UK, you will find that that is not the case, and for a majority of pregnancies, you will probably only have about 10 to maybe 15 appointments throughout the entire process. But of course, this can vary from family to family, and if you have any sort of complications or things that we need to keep a closer eye on, you may have some additional visits. Midwives are going to be taking care of you for all of this. So they will be referring you for any ultrasounds that need doing or for any further testing. So things like blood work or your glucose tolerance test or GTT, which we'll talk about in another video. But generally you will find that the rest of it is really done hands-on by the midwife, similarly to what you may expect your OB or nurse practitioner to do in the US. The midwives are really, really well trained, and they're very, very knowledgeable on all aspects of pregnancy and birth, not just sort of the, physical part of being pregnant, but there's a very, very kind of holistic approach that in some ways people argue lacks in the US, but that is a conversation for another time. So, one of the first people that you're going to see is probably going to be what's called an MSW or MCA, maternity support worker, or maternity care assistant. This is particularly true in hospital settings. So a lot of the times MSWs or MCAs might be the ones admitting you in. They might be doing some vitals checks, so things like your blood pressure, your breathing, getting you orientated to the unit or ward, as they're called here in England. And they will probably be the ones doing some blood work and kind of just getting you situated before a midwife is ready to come see you. MCAs and MSWs can work in inpatient settings, so things like antenatal wards, delivery units, birth centers, postnatal units, or they can also work on an outpatient basis or a community basis. So this may be in specialized clinics where maybe you're coming for fetal medicine, or preterm surveillance clinics, or places like ultrasound clinics. And this will also very much be at your community-based appointments, which is where you will typically be going for the majority of your prenatal care. MSWs and MCAs are trained to different levels in different trusts. So this might be a Band 2 MCA that has less responsibilities, although most MCAs and MSWs are now Band 3s, and there's a lot more things that they're able to do, myself included. I am an MSW. And so at this point, we have a lot more clinical kind of hands-on care that we are providing. So RMs, or registered midwives, kind of the star of the show, they're the ones that are going to be delivering all of your wonderful care throughout your maternity journey. So from the moment that you become pregnant and all the way through postpartum and those early days at home with your little one, and sometimes back in the hospital if you require any readmission. So sometimes people may have complications like infection, or there may be challenges with postpartum bleeding or anything like that. So if there is a readmission, a lot of times those readmissions are also attended by midwives in the hospital, rather than necessarily escalating straight to the obstetric team. Again, it will depend on complications, and my hope is that none of you have to go through this, but that is something that can happen in the postnatal or postpartum period as well. So our lovely registered midwives are the ones that are taking care of you throughout the pregnancy, birthing, and postpartum process. They have a lot of really, really great hands-on training. So most midwifery programs are going to be 3 years, and usually starting within that second year, the midwives or student midwives are already in hospital settings and in community settings. They are attending appointments, they are attending birth, they are working alongside registered midwives to learn all of that hands-on care. They are required to catch a certain number of babies before they can be fully registered, or before they essentially have their license. And there's quite a lot of extensive hands-on training that goes into this before they become qualified. So midwives take on a much more holistic approach to birth, and you will find that midwives are taking care of not only your physical needs, but there's also quite a lot of emotional support, there's social care, and there's also some specialized midwives as well that can attend to you throughout your pregnancy journey. So while you are still pregnant, you may be seeing midwives that are supporting with safeguarding. So this is looking at some social aspects, or almost like a social work level support for anybody that might be dealing with challenges at home, or there may be young people that are giving birth. So sometimes when we have teenagers, safeguarding might be put into place. Or in cases where there might be some challenges at home going on, God forbid, there's things like domestic abuse, or there's concern about the baby's well-being once they're born, specialty safeguarding midwife may be involved in the care. And then we may also bring in some social workers as part of a multidisciplinary approach, but typically specialty midwives are going to be the ones involved here. Another type of specialty midwife that you may be seeing, if this is a case for you, is a smoking cessation midwife. So this is somebody who's very well trained in supporting expectant parents in stopping smoking as part of their overall health, and making sure that we're doing this in a sustainable and long-term kind of way. So this is somebody that you may end up seeing during your pregnancy if this applies to you. Some other types of specialty midwives that you may end up seeing are mental health midwives. So they have some additional training in supporting any kind of mental health needs during the perinatal period. And then we also have some specialty midwives that you'll be seeing postnatally for breastfeeding support. So unlike the US, where majority of breastfeeding support is provided by lactation consultants or IBCLCs, in the UK, majority of that support is actually provided by feeding team midwives. There are some IBCLCs that do work in NHS hospitals, but majority of IBCLCs or lactation consultants are actually in private practice in the UK. And it's midwives that have been specially trained for the feeding team and have a lot of additional sort of knowledge in breastfeeding support that are going to be offering that support in the postpartum period. MSWs or MCAs, maternity support workers like myself, are also able to offer breastfeeding support. And I do a lot of breastfeeding kind of hands-on education and support with my postnatal families on the postnatal ward where I am currently stationed. So there's a lot of education and support that comes from MSWs, and then for anything more complicated, we're going to involve some specialty feeding team midwives. And then finally, again, something I hope that none of you have to encounter, but there are also some specialty bereavement trained midwives. So for anybody that experiences pregnancy loss at any point during the pregnancy process, but especially so later on, or if there are medical needs to terminate or a decision to terminate, some bereavement specialty midwives might also be involved in your care. Some midwives work both in a community setting and then inpatient in the hospital, so they may split their time between the two. So it's possible that if you're having a hospital birth, whether in a birth center that's attached to a hospital or in the more kind of complex delivery unit, it's possible that you may end up seeing the same midwife that you saw for your prenatal sort of community appointments. In other cases, we have some midwives that just specialize in community and some midwives that just work inpatient. And so you may see them on an antenatal or kind of a high-risk pregnancy ward. So sometimes we have people that are admitted to the hospital while they are still pregnant, and maybe we need to keep a close eye on them. Maybe they're temporarily admitted and then discharged until they're ready to give birth, or sometimes they may stay in all the way until their birth because of certain high-risk complications. At that point, inpatient midwives will probably be the ones looking after you. Once you are ready to go into labor, you already are in labor, maybe you're coming to the hospital in labor, and maybe you're going to the birth center that's attached to the hospital, or you're going to the delivery unit. In all of those cases, the midwives will be providing your care, and at that point, it's usually one-to-one. So it's not unlike a labor or delivery nurse in the US, but again, it's a much more holistic way of delivering care, and they're usually the ones catching the babies. Nurses in the US do not want to catch babies. That was certainly my experience when the nurse told me I needed to wait for the doctor to get there because she did not want to catch that baby. And generally that is true. The nurses can do it in emergency situations, but typically they ideally would prefer not to. There's liability issues, there's insurance issues, there's all sorts of complications there. Whereas in the UK, midwives, again, in most typical births, are the ones delivering the babies, even in situations where mom has an epidural. And midwives will often also provide support in C-sections. So they are not the ones performing the C-section. That would be done by an obstetrician consultant. But typically midwives are still present in the OR and providing a lot of hands-on care for you and the baby during your C-section. So they really are involved from start to finish throughout the process. In certain cases where medical complexities arise with your pregnancy, or maybe you have complications or health comorbidities or other kind of more complex medical concerns, an obstetrician consultant may be overseeing your care and working in collaboration with the midwifery care. So at that point, they're going to kind of balance ideas back and forth, the best possible way to look after you and baby in a safe way. But in majority of cases, if it's a typical low-risk sort of run-of-the-mill pregnancy, then you are looking at midwifery care throughout the process. And occasionally a consultant obstetrician may take a look at your chart, or a midwife may refer you for a single visit just to sort of dive deeper into any concerns that they may have. But otherwise, it's really the midwives that are doing the bulk of the caretaking from start to finish, and even into early postpartum days, with things like home visits and support for you. And another big expectation is that babies will be seeing a pediatrician in kind of their outpatient care once they've been discharged from the hospital, which is the typical process in the US, but is not typically the process here. Pediatricians in the UK are a more specialized breed, and so these are a group of doctors that you may be seeing if your baby or child has more complex needs. But otherwise, most kiddos are seen by a GP or a general practitioner, the same way that like family doctors can see any age in the US. Typically, GPs here in the UK will be seeing your kiddos as well as yourselves, as well as elderly people, and kind of the entire lifespan. So, you've had your beautiful baby, they're in your arms, you and baby are doing well, it's been a couple of hours after birth. At this point, you can be expected to be transferred to the postnatal ward or postpartum unit. And this is typically where you will be for the remainder of your hospital stay. Sometimes if you had a cesarean birth, you may first go to a recovery unit or what's called close observation unit. And this is where we have a little bit more specialized care, one-to-one, and this is where we look after some of our more complex cases or maybe somebody who's just come out of surgery. But again, after a couple of hours, if everything is looking healthy with you and baby, you will step down or basically level down in care to a typical postnatal ward. And this is where you and baby will be for the remainder of your hospital stay. Most hospitals in the UK are going to be practicing baby-friendly initiative practices, and specifically they will be rooming in with your baby. So you're not usually looking at being separated from the baby unless they need NICU time. No, most hospitals in the UK no longer have a well baby nursery, so baby doesn't go anywhere else. They stay with you, as this promotes bonding, breastfeeding, and usually accelerates the time that you're able to kind of get home and settle into your new life with the baby. On that postnatal world, there will still be kind of a multidisciplinary approach to seeing you. Again, majority of that care will be delivered by the midwives, but we will also have some specialty midwives checking in on the baby, making sure the breastfeeding is going well, possibly doing that NIPE check, and again, just making sure that you and baby are transitioning well into your new routine. You will also probably get a visit from a physical therapist who's going to talk to you about pelvic floor therapy. Our pelvic floor therapy and our pelvic floor well-being is something that is incredibly underattended to, and especially so across the US. There are some PT sort of specialists in pelvic floor health that are arising across the US, but you may find that most insurance plans don't even cover those visits yet, and most people are seeing them out of pocket, which is not always accessible cost-wise. In the UK, it is pretty routine to have that PT come see you and talk to you about pelvic floor therapy. For some people, they may require several visits in the postnatal period, and for some people, it's just a general conversation about overall health, some of the things that we can do to strengthen our pelvic floor after pregnancy and birth, and to maximize that health generally, but also if we plan on having any more kiddos down the line. So that is one of those multidisciplinary approach kind of people that may be visiting you on the postnatal ward. Occasionally, you may still see an obstetrician, especially if you're in that recovery or close obs unit, just because sometimes there may be complications that require their attendance. And then in rare cases, if we have any concerns about the baby, we may have a pediatrician, a hospital inpatient pediatrician, come and see them while they are on the postnatal ward. Of course, if they're on the NICU, then specialists and all sorts of very, very knowledgeable people will be seeing them there. But if they're on a typical postnatal ward, but midwives feel like they want a little bit extra oversight or support, they may ask a pediatrician to come see your little one. Once you're discharged and you're at home, typically for the first couple of weeks, a midwife will be visiting you at home. Visits usually happen on day 5 postnatally, sometimes day 8 or 10, and they're checking up on baby's weight gain, on your healing, doing some additional testing. Sometimes that blood smear test, similar to what we do in the US to check for genetic abnormalities, that may be done in the hospital or that may be done by your visiting midwife at home. And again, breastfeeding support, postnatal support, healing support is all provided at those visits. After about 2 weeks postnatally, if everything is looking fine, you're discharged from midwifery care, and then you may have a nurse qualified as a health visitor seeing you a little bit longer at home. You may also be going to see your GP just to make sure that, your health is recovering well, and then you'll probably be doing a checkup for your little one around 6 to 8 weeks postnatally. And then finally, you will have that 6 to 8 week postnatal checkup with your general provider or GP, and they're the ones that are going to fully sign you off and say, yep, you're pretty much healed from birth, you're back to normal, although there's a very wide range of normal. Some other providers that you might encounter on your pregnancy journey are similar to what you might expect in the US. So you might have some phlebotomists doing your blood work. You might see sonographers doing your ultrasounds. Sometimes it could be a doctor or an obstetrician doing your ultrasounds. In particular, the hospital where I work, we have a preterm surveillance clinic, which is where certain doctors, part of that multidisciplinary team, will scan moms or do those ultrasound themselves for anybody who has threatened preterm labor or the potential to go into preterm labor or any sort of signs of being kind of high risk for a preterm birth. And so at that point, instead of having a sonographer doing these scans, we actually have the obstetricians doing this firsthand, taking a look right away and giving you the results and having a conversation of what that process may look like. You may also occasionally see a nurse for maybe some testing or sort of routine checkups, or sometimes a nurse may work as what's called a health visitor. And a lot of times health visitors will come see you postnatally at home once you and baby have been discharged from midwifery care. Typically, midwives will work with you in the postnatal ward or the postpartum ward, similar to what a labor and delivery and postpartum nurse might do. And then they will also probably see you at home in the first 2 weeks or so after birth. And then at that point, if everything is looking routine and normal, a health visitor may take over and still see you for the next couple of weeks. Again, we may have complications that require further midwifery care, or sometimes we will put women on a 28-day pathway, and this is a support system in place for anybody who is high risk for perinatal or postnatal mood disorders and requires some additional support in that sense. So you may be seeing a mental health midwife after birth for some time, for another several weeks. And then again, there's other places of support involved here, but those are some of the other practitioners that you may be seeing throughout your pregnancy journey in the UK. So finally, the thing I want to touch on is oversight, because like anybody who is going to be in this type of medical profession, midwives are going to have some oversight. Typically, this oversight is carried out by the NMC, so Nursing and Midwifery Council. They're the ones who make sure that our licenses or registration is up to date. They're the ones that talk about requirements for liability insurance, which is typically covered by the hospital when you're employed by a hospital. But for any midwife that wants to practice privately, they would need indemnity or liability insurance. And they're the ones who really look after the safety of patients and make sure that midwives are practicing within the normal scope of practice and that things are really, really as safe as possible for our patients. So if you want to learn more, you can look up the NMC or the Nursing and Midwifery Council, and they have quite a bit of really great resources, one of which is linked below this video. So, I hope this gives you a little bit of an overview of the various people that might be taking care of you throughout your pregnancy and birthing journey and that early postpartum journey here in the UK. If you found this information useful, please feel free to share it with anybody else who might need it. Leave a comment below. Let me know what you found the most interesting. Let me know if you have any questions, and I can dive deeper into some of these roles and this kind of multidisciplinary team approach. But really, we have to remember how incredibly helpful and supportive and knowledgeable and wide-spanning midwives are in the care that they're able to deliver, both generalized midwives as well as those that are a little bit more specialized or specialty midwives. Thank you so much for joining me today. Welcome to Perinatal Bloom. We're going to keep unpacking all things birth and beyond. And if you found this information useful, I'd really appreciate it if you consider subscribing and sharing with friends or family who could benefit from this information.